The battle over health care continues to heat up. 4 states challenging the new law. They claim the federal government simply does not have the constitutional power to force state residents to buy health insurance. We're joined now by Sreedhar, Potarazu, President and CEO of Vital Spring Technologies. He is a doctor. He is a successful businessman. He is somebody with a lot on his mind as well. Sreedhar, welcome to the program.
Thanks for having me on.
Ultimately, do you think that these constitutional challenges are going to play out?
I think there's a chance. And if you look at what's happened in Virginia and in Missouri in the last week or so, there's some concerns by the administration that perhaps this train is going to come to a halt and other states stepping in to rule the fact that the mandate was not constitutional, that the government has overstepped its bounds in terms of what it can and cannot regulate. And there's a lot of concern amongst the governors in terms of the impact of what health care is doing and going to do in the future.
But I'm a little confused because you run a company.
I do.
We had a guest in the 11 o'clock show. Guy runs about an 80-person company who said that he's not hiring, in part also because of health care and other taxes. We were sold that this was supposed to help people like you.
We were sold on a lot of things. And
you don't think it will?
It's going to be very difficult because small businesses are reluctant in order to hire. There's nothing immediately available that enables companies to go out and better negotiate with insurance carriers. In fact, rates have gone up for small businesses in the last few months. Insurance carriers are doing everything they can in order to navigate the system to make up for having to take on all of these sick people. So nothing has really changed, and the government is trying to catch the tiger by its tail and trying to bring the premiums down, but that hasn't happened yet.
And that's an interesting observation that we have heard from other companies, too. They feel the insurance companies are sort of turning the screw, jacking up the rates on them, because they know that they've got to make more money off of the employed so they could fund more people who will be accessing health care.
Yeah,
is that a fair statement?
That's a fair statement. The other thing they're also doing is that the new regs are coming out shortly that insurance carriers have to stay within limits of what's called the MLRs, the medical loss ratios, meaning that they've got to spend X number of dollars on taking care of people. But the medical insurers are now working the system to start adding on things to the tab that may or may not be medically related just to meet those numbers. And in some markets, we've heard that they said, look, we're just not going to cover the individual policyholders, and we may choose not to do that. So what happens? Falls back on the states. And this is why the states are revolting.
Sreedhar, Potarazu, it's all the time we've got, but we'll bring you back on soon. I know you're a frequent guest. We'll have you back on again.
Look forward to it.
Thank you very
much.